Dengue fever is one of the commonest viral fever during this season. Let's talk about dengue today. Hi, I am Dr. Ritesh Aggarwal, Associate Director, Smart Super Speciality Hospital, New Delhi. As you all know, dengue is a mosquito-borne disease. Dengue has a varied spectrum of its manifestation. Patient can have mild symptoms like fever, headache, body ache, rash, or the patient can have severe symptoms which include bleeding, fall in blood pressure, multi-organ failures. If it's a mild dengue, these patients are best managed at home with hydration and paracetamol for fever and body aches. You can give simple plain water, you can give juices, you can give chach, lassi, pomegranate juice. If the patient has severe dengue, so 10% of the patients develop severe form of dengue disease. Who are these patients? These are vulnerable group of patients. There is a general feeling that if the platelet count of the patient is very low, that is a severe dengue. Yes, low platelets can mean a severe dengue, but there are more important signs and symptoms which suggest a severity of dengue disease. A dengue patient with vomiting and pain abdomen, a dengue patient with respiratory difficulty, breathing difficulty, a dengue patient with altered sensorium, a dengue patient with bleeding manifestations, fall in urine output. These are the group of patients which are very severe, which are having very severe dengue disease. The other group of patients are vulnerable group of patients. If the patient has got comorbid diseases like diabetes, chronic kidney disease, chronic liver disease, hypertension, heart disease, or if the patient is immunocompromised, he is a cancer patient, if the patient is on steroids, if the patient is advanced age or pediatric patient or pregnant patients, these are the group of patients where the dengue can rapidly progress downhill and can be serious. There is a general feeling that if the fever settles in a dengue patient, the patient is no longer serious. This is a myth. In fact, most of the complications of dengue, they start appearing after the fever of the patient settles. These are the group of patients who should be brought to hospital early and in time, because if an early and appropriate treatment is given to these patients, then the mortality, the death rate can be brought down from 20% to as low as 1%. So what are the take-home points? Mild dengue, please manage at home with good hydration and plain paracetamol or crocin, but keep a watch on the severity symptoms. If the severity symptoms appear or the patient is a vulnerable patient, please bring the patient to us. We'll take care of him. Thank you.
Subscribe to our YouTube channel and press the bell icon to get the latest healthcare updates.